Hello everyone, my name is Joel Nunez, and in this video I'm going to be showing you the procedure for the 7 sites skinfold assessment. In taking these skinfold measurements, it should be noted that there is a standard error of estimates that is plus or minus 3.5%. Extreme obesity, inexperience on the technician's behalf, and faulty calibration of the calipers are the 3 components that can impact the standard error of estimates. When taking the skinfold measurements, the measurement should always be taken on the right side of the body, with the subject in an upright position. We're going to go ahead and proceed with the measurements, starting off with the subscapular. For this measurement, the arm can be placed behind the back so that the subscapular can be seen easily. If it is already seen, then the arm at the side is fine. The subscapular is a diagonal fold 1 to 2 centimeters below the inferior angle of the scapula. Once this point is found, go ahead and mark the location with a pen or a marker for consistency in measurements. When taking measurements with the caliper, it is important to remember that the caliper be placed 1 to 2 centimeters from the location, and it should be about the halfway point between the crest and the base of the fold. We should hold the caliper for 2 seconds in this position before taking the reading. Next, we will be working with the triceps, and the location we want to be at for the triceps is the halfway point between the acromion and the olecranon process. The fold at the triceps is a vertical fold. From here, we move to the front of the body. The suprailiac, which is a diagonal fold in line with the natural angle of the iliac crest, and the interior axillary line superior to the iliac crest. Next, we have the abdominal. This is going to be a vertical fold 2 centimeters to the right of the umbilicus. After this, we are going to measure the chest. While the diagonal fold remains the same for both men and women, it should be noted that for men, the location we take the measurement from is halfway the distance between the interior axillary line and the nipple. For women, however, we measure from a third of a distance between the interior axillary line and the nipple. Next, we have the mid-axillary line, which is a vertical fold at the level of the xiphoid process at the sternum. The final fold that we are going to be doing is the thigh. The thigh is a vertical fold on the anterior midline of the thigh, midway between the proximal border of the patella and the inaugural crease. When taking the thigh measurement, make sure all the weight is placed on the left leg and that there is a slight bend at the knee in the right leg so that it is limp. For accuracy and consistent results, it is best to wait 1 to 2 minutes before taking measurements at a certain site again. Take the 3 measurements recorded at each site and calculate the mean. You will add up the means of the 7 sites to use in the following formulas. The formulas shown before you depict how to obtain your body density from the 7 skinfold sites. Notice that the formulas for both the men and women have slight differences. Nonetheless, the sum of the 7 skinfold sites should be taken and inputted into the space where it says sum of 7 skinfold sites. After the body density equations, we have the Seery and the Brozak equations for calculating body fat percentage from body density. The Seery equation is as follows. Body fat percentage equals 495 divided by the body density, all subtracted by 450. For the Brozak equation, the body fat percentage is calculated by 457 divided by body density, all subtracted by 414.2. And this is the procedure for the 7 sites skinfold assessment. I'm Joel, and thanks for watching.